in your own
Okay.
words,
Can you
why
still
we're
hear?
doing tonight's call. Go ahead.
Okay, thanks. So you can still hear me. Is that correct?
Yes.
Yes, and we are
Okay.
recording the session so that we'll be able to send it out or have it on archive.
Okay. Well, thank you all for your patience in getting me on the call. I'm Emily Fulmer, and I'm really excited about this call because, number one, I used to work at the Tennessee Healthcare Campaign, and I've so enjoyed working there. This was almost 10 years ago now when we were working on healthcare reform the first time. And I know that the Tennessee Healthcare Campaign and the Tennessee Justice Center are the long game experts on this stuff. And I'm just so thankful, especially today when a lot is happening. This is the most perfectly timed conference call in the history of the planet, I think. The proposal came out, and here we are. We have these experts on the phone with us. So I really appreciate you all taking the time to educate us. I am just a regular volunteer, but with an organization called Indivisible Memphis, and I think a lot of people on the call today are probably connected with us on Facebook. We're part of the larger Indivisible movement, which you may be aware of. If not, you can check it out online. But basically, my new best friend, Mary Green, went on Facebook and decided to start a Facebook page called Indivisible Memphis about a month ago. And in that time, we have now almost 1,000 people in the group on Facebook. And the amazing thing to me about the group is we're Indivisible Memphis, but so many people that are involved are like me, living out in the conservative suburbs outside of Memphis, who, we felt like we were the only ones out here, and suddenly we're getting organized and we're creating a powerful resistance movement. And part of our resistance movement is defending the Affordable Care Act. And while we cover all of West Tennessee, and we work with other groups like Together We Will West Tennessee and lots of other advocacy and, progressive movements in the area, we have the unique opportunity to do a lot of organizing in District 8, because Cohen in District 9 is always, on board. But in District 8, we have a brand new U.S. Congressman named David Kustoff. And during the last recess, we tried really hard to get a public meeting with him, and we were not successful. We will make that happen during the next recess, whether he comes or not. But we did have a meeting, a really good meeting, I thought, with him. And a group of 12 who we were informed, we were polite, and we were prepared. And he was not prepared for what he experienced. And what the cool thing, a lot of cool things happened with that. I won't go into the details, but he said to us, will you come back when the Republican ACA replacement bill comes out? Will you come back so we can talk about that together? And we were like, hell yeah, we're coming back. So this webinar for us over here in West Tennessee is our chance to become citizen experts on this, so that when we go back to that meeting with Kustoff, we're prepared with real information, because he really doesn't know what any of this is about. So that's all I'll say, is that, this is our education to prepare for that meeting and to protect the ACA. So that's all for now. I'm available at the end if we want to talk strategy for that.
Thank you, Emily. I appreciate that so much. It's really nice to hear your voice. The person speaking right now, I'm Tony Garr. I used to be the director of the Tennessee Healthcare Campaign. Now I am retired, and I'm a full-time volunteer. So there are a lot of volunteers that are working on this to save the health insurance and healthcare for millions of Americans, and actually what amounts to probably 500,000 people right here in Tennessee. So I want to walk you all through what we know, and please understand there's a lot we still don't know. This just came out last night. And I need to also just sort of thank our national partners. We get information from Community Catalyst, from Families USA, also from the Center for Budget and Policy Priorities. And like Emily referred to earlier, the healthcare campaign and the Tennessee Justice Center work hand in hand with each other in helping us understand implications of different laws. The Tennessee Justice Center has some very important uh, information and know-how about how TennCare works, uh, and so they can technically help us understand what this might mean. A lot of the slides that I will be using tonight are thanks to the Tennessee Justice Center. They gave me permission to borrow many of their slides. I modified some of them, so this is going to be a mix of some of their slides, some of my slides, some stuff from the Center for Budget and Policy Priority, from the Kaiser Family Foundation. So there's going to be a lot of different sources as we go through this. So let's go to the next slide. And we're going to try to get through this in less than 40 minutes, so we'll have time for questions. And this is the outline that I want to follow, what the current status is, what the GOP proposal, repeal proposal is, to the ACA and to TennCare Medicaid, and what the local impact and action will be. So that's the general outline, so just keep that in your mind. Next slide. So the current status. This is just a 2-year comparison, even though we have more. We actually have 3 years under our belt and part of 4 years, but at least give you some general trends. I was able to capture this information from the Kaiser Family Foundation. You might notice that the average uninsured rate in America is the green line, and you look at when the ACA started, it was around 18%. Now we're looking at somewhere around 10%. Actually, it's showing about 13%, but we also know that right now it's actually below 10%. It's probably lower than 9%. So the lowest uninsured rate in America is now occurring. It's never been this low. I also put in Arkansas and Kentucky. You notice that Arkansas is the red line and Kentucky is the yellow line. Tennessee is the blue line. Arkansas and Kentucky did expand their Medicaid program, and so you see their rate of uninsured rate continues to decline. Also, I might add overall the lowest uninsured rate for children is somewhere below 5%, so we have never seen that in this country. And we'll talk a little bit more about why all that's happening. So there's sort of this partner effect when something happens, and there's always woodwork effect. So let's go to the next slide. So the next slide is just in general, just some general information about Tennessee. So let me just walk you through that. Currently, 3.3 million Tennesseans have their health insurance through their employer. And, you know, you might say, well, what do they have to do with the ACA? Well, it's the end of annual and lifetime limits. Believe it or not, even large employer had lifetime and annual limits. And young adults can stay on their parents' plan to the age of 26, and free preventive health service and free contraceptive services. Now, once again, there are many more benefits, but these are just some highlights. There's 1.5 million people on Medicaid / TennCare. So when I refer to Medicaid in Tennessee, it's the exact same thing as TennCare. The big thing that happened even though we have not expanded TennCare, Medicaid in Tennessee, the big thing that has happened is in Tennessee, since the Affordable Care Act, there was a change in the state plan, and both parents can be covered who are up to poverty level. You know, we always known before that a single parent with a child could be covered, low income could be covered under TANF. That's temporary assistance for families with children. But now both parents can be covered since January 1, 2014 when this started. Also, currently, after this last open enrollment period, 238,000 people have enrolled in the Affordable Care Act. And in Medicare, we have 1.2 million people on Medicare. So that's sort of a bird's eye view of how people have their health insurance covered in Tennessee. We have about a little over 6 million Tennesseans. Next slide. So as we think about that, I want to give you some really specific uh, numbers for Shelby County uh, and show you what the increase was. So I took December 2013 before the ACA began, and January 2017, which is the last numbers, and you can see even though we did not expand Medicaid, 22,000 additional kids 0 to 18 years of age now have health insurance, and you can sort of see the numbers. You see 25,941. That's that third column. This to me represents many parents who before were not insured and now they're insured. And the total increase just in Shelby County, so I'm sorry I didn't put that on there. I should have been more explicit. TennCare and Cover Kids enrollment in Shelby County. So we're seeing 51,000 additional people just in Shelby County who now have health insurance who did not have it before under the ACA. Next slide.
Nope.
This next slide is a map, and this map shows the Medicaid expansion, but I wanted to sort of bring this out and just sort of keep this in mind. All the blue and red, those are all states that have expanded their Medicaid program. The only difference between the blue and red, the red represents Republican governors where their state has expanded the Medicaid program, and the blue represents Democratic governors where the Medicaid program has expanded. So one of the things that's happened as we'll go through this, part of the ACA repeal and replace is to also change the way Medicaid is being paid for, which will have a very serious negative impact on children and everyone who's currently eligible for Medicaid in Tennessee. So look across the map, sort of take a picture of that. You notice that Tennessee, we're sort of in the gray. We did not implement a Medicaid expansion, but people who are above poverty have enrolled. Like I said, 238,000 people have enrolled in Tennessee. And we've had some woodwork effect where more people are now covered by Medicaid than they were before. But if we would have expanded Medicaid, we'd have another 300,000 plus people who would be eligible. Just north of us in Kentucky, they did expand Medicaid, even though they have a Republican governor now. They have close to 400,000 people in their Medicaid program. Arkansas, close to 250,000 people. Louisiana, they've now enrolled over 350,000 people, and they just started a year ago. So a lot of people are getting health insurance. You notice over to the left, Alaska, they have an independent governor. Hawaii has the Democratic governor. So both Alaska and Hawaii have expanded their Medicaid program. Next slide, please. So that sort of gives you the broad scope of what's happening. Now we're going to go directly into the repeal and some of the things that's happening. So the way it's happening is they're in their the current repeal effort is in the House, and after it goes through the House, then it will go to the U.S. Senate. In the House, it's under two different committees, the Way and Means Committee, and also the other committee is the Energy and Commerce Committee. The Ways and Means is going to focus on the ACA and doing replacement there. And the Energy Committee is going to be focusing on Medicaid. There are section-by-section summaries. Those kind of things can be emailed to you all. Emily, I don't know if you have everyone's email address. We do not have that. When you signed up for the webinar, you had to also put in your phone number, I think. But also, if people in their chat box, could put in their name and their email address, we can make sure that we can send you a set of these slides as well as some other attachments. So go to the chat box, put in your name and put in your email address, and we can email you this slide presentation as well as some other attachments like the section-by-section summary. Let's go to the next slide, please. So we're gonna basically tackle a couple of different things as far as why this really hurts Americans / Tennesseans. Overall, I've looked at several reviews from even preliminary information from the Center of Budget Policy Priorities, from Health Affairs, from the Kaiser Family Foundation, et cetera. They're all saying that the current bill that we're looking at that was just made available last night is going to benefit those who are wealthy and healthy, and it's going to hurt those who are low income and sick. Next slide, please. So as we think about, what are the reasons it's going to hurt people? We're just talking about the ACA. So the ACA, why is it going to hurt people? It's going to hurt people primarily because of, go back, oops, one more slide.
Forward.
One more slide, yeah.
Okay, sorry.
Okay, so this is one reason why it's going to help the wealthy and those who are healthy. If you're familiar with health savings accounts, they were not part of the ACA. This bill will create health savings account, allowing wealthy people to put in a significant amount of money that's tax-free into savings accounts, health savings accounts, to which to pay out their premiums and their deductibles and other things. However, as you know, people who are low income or middle income even, they don't have the extra money to do that. So it's pretty hard for them to take advantage of this. Just another little tidbit, 65% of Tennesseans have less than $1,000 in savings in the bank. So when you take that in consideration, you realize that, what they're proposing is going to help those who are healthy and wealthy and not going to help those who are poor and lower income or even middle income. Next slide. So another reason why this is going to help hurt the poor is the way they're going to be doing tax credits. Currently, the ACA, if you're familiar with it, you get what they call advanced tax credits. So you actually get them up front. Now they're talking about these tax credits will be, you actually get these tax credits after you file your taxes. And so most people who are low income, and I was a certified application counselor, I helped enroll people. Most of the people, gosh, I would say 90% of the people I talked to, they didn't have that kind of money up front to pay for their premiums and later on to get a tax credit. And also, even the tax credits are going to be less than what they're currently getting. So it really does mean that Americans who are currently benefiting mostly from the ACA will substantially get less help. The next slide. So we're going to go to reason number 2 of why this bill really hurts Americans. It also makes it less accessible and affordable. Next slide. People who have medical conditions, right now you can't ask those questions. And before the ACA, if you had diabetes, if you had any kind of medical condition, asthma, diabetes, heart condition, many times you were turned down for health insurance, or you had to pay more even to get it. And if you're a woman, you know that many times you couldn't get coverage for your pregnancy if you were, especially on the individual market. Now there are new barriers and it's going to have a new requirement. So if for some reason you've lost coverage for 65 days, if you want coverage, you'll be forced to go into a high-risk pool, which usually has waiting periods, and also the premiums will be up to 30% more. So let's go to the next slide. So this is going to make coverage less accessible and less affordable. Another reason it's going to hurt is out-of-pocket costs. Under the current ACA, there are cost-sharing reductions that are available for out-of-pocket costs, especially if you're under 250% of poverty. Those are going to go away under this plan. So once again, it's going to make it more and more expensive. Next slide. And the third major reason that is going to hurt people is primarily because of the lack of consumer protections. When we knew that if you were buying a bronze plan it had an actuary value that it was going to cover 6% of all the medical care you needed. You could go to a silver plan, 70%, etc. The having that actuary value and score is sort of going to go away under this bill, and so sometimes it's going to be hard to know what you buy. You might buy a pig in a poke. You might buy it because of marketing, but really you won't have a real good feel for what the value of the plan is that you're buying. Let's go to the next slide. So this sort of gets us back to Tennessee. Just real quickly, in Memphis, in Shelby County, there are 26,000 people who enrolled in the marketplace, and 22,000 of these got what they call premium tax credits, and also 15,000, almost 16,000, got additional cost sharing reductions. So if all of a sudden they take away the cost sharing reductions for folks there in Shelby County, and rather than having advanced premium tax credits, you have tax credits after the fact. And most of these folks, and these are folks, a cost sharing reduction are folks who are below 2.5 times poverty. They simply are not going to have the extra funds they need in order to pay their premiums, pay for their care. And it really is going to have a serious negative impact. Next slide. The next two slides are going to show you basically what these estimated cuts are going to be. So if you look at the first column, you'll sort of see the current law, the kind of help that people are getting, and then you're looking at the second column, which shows if they repeal the ACA, an average of over $1,000 will be lost in regards to helping people. And if you go to the next slide, you're also counting in Medicaid some additional losses. So let's go to the next slide. So this is going to have a real serious impact on people in Tennessee being able to get coverage. This slide just came out this afternoon. This is from the Center for Budget and Policy Priorities. Oops, back up. This shows you over a 10-year period what the negative impact of this would be. They talk about things that would stop at the end of 2020. So the Medicaid expansion, dollars would no longer be available for Medicaid expansion. You have the ACA expansion groups, and this is sort of the estimate. So over a period of 10 years, this is money that will be lost to the states of $370 billion will be lost to the states. This can, you can only do so much with so much money, but if you don't have the money, you don't have any flexibility. You just have to cut either people, cut payments to providers, or cut benefits. Next slide. So next slide. So we're looking at over a period of time, gradually big cuts, and that's going to result in fewer people being covered. We all heard, maybe remember back in 2010 after the law was passed, and a lot of the Green Party uprising that occurred. They talked about rationing care, about grandma, we're killing grandma, we're going to take her health care away. Well, as it turns out, ACA didn't do that. The ACA actually even protected grandma. What we're looking at now is truly people losing coverage. Let's go to the next slide. To give you an idea of how this is gradually going to happen, the per capita cap, they say, well, for each person, we're going to pay so much to that state for that person. We have, from what we know, this is going to grow at the normal inflation, but as you and I know, medical inflation really increases faster than normal inflation. Normal inflation might be 2%, medical inflation would be 4 or 5%. Even though the ACA had significantly reduced medical inflation from the 8-9% to 4 and 5%, it's still more than regular inflation. So under the per capita cap formula that's being proposed, the growth of funding to the states would only grow under the regular inflation. Next slide. And this next slide shows a graph that shows how this over time will actually cause states to have to make cuts. Either you cut ineligibility, you cut people off so you no longer have that guaranteed coverage. You charge more in premiums so people cannot afford it. So you can sort of see as far as the amount of funding that a state would receive for each person is going to gradually decrease. Next slide. So currently, we're looking at across the country 33 million people who are children who are being covered per capita cap / block grants. Whether you call it block grants, whether you call it per capita cap, what it means is cuts. We have 16 million seniors across the country, 10 million people with disabilities. When we say seniors, we're talking about seniors in nursing homes. 61% of people in nursing homes in Tennessee are funded by TennCare. So if these cuts continue to happen, states at some point are going to have to make choices. Do we cover kids, or do we cover people in nursing homes, or do we cover people who have disabilities? Next slide. We're simply not going to have the money to fund all this. We've already talked about this in regards to how this is. It talks about shifting costs to the states. My major concern is that our state of Tennessee will just choose not to fund it, and they can do that. So it's not a matter of shifting costs to the states. It's a matter of, well, when that happens and no longer funded by federal dollars, our state government will likely say, we're just not going to cover either that group of people or that benefit, or we're not going to pay that provider what they need. This will have a serious impact on rural hospitals. Next slide. Even though the repeal, you may have heard that essential health benefits are still part of the ACA, but they were also part of the Medicaid program. What this does is this tells the states that the states can decide what are the health benefits for the Medicaid program. So essential health benefits no longer apply to Medicaid. And so, once again, this is an area where we had some federal protections, and those would go away under this scenario. Next slide. And this bill effectively ends Medicaid expansion. It says at the end of 2020, states are going to have a chance to expand up to that date. If they don't expand that date, they're going to be locked out. I'm not sure, basically, that Alexander and Corker are going to, or I'm not sure our state senators and our state representatives are going to do a Medicaid expansion. And if they don't do it by 2020, according to this bill, would be locked out. Even though there were 4 Republican senators who signed a letter saying that they could not support this bill, overall, the bigger picture is that 52 U.S. senators are Republican, 48 are Democrat. We need to peel off 3 to 4. 4 would be better. U.S. senators who say, look, we're not going to support this. 2 of those 4 likely live here in Tennessee, Alexander and Corker. Next slide. So just another wrap up in regards to how important the Medicaid / TennCare program. Half of all children are covered by TennCare or cover kids. Half of all births are covered by TennCare. 61% of people in nursing homes are paid for by TennCare. 2/3 of people who basically are disabled are being funded through the TennCare program. And for 50 years, the Medicaid program started in 1965. So for 50 years, this has been the cornerstone for healthcare. Also, TennCare is the largest provider for mental health, behavioral mental health services in Tennessee, and rural hospitals really depend on TennCare and Medicaid. So if you start seeing these kind of cuts in the TennCare program, it's going to have a serious impact. I mentioned this earlier, that 7.6 billion of Tennessee's state budget, of which 20% is the TennCare program. Next slide. I'm going to try to get through this real quickly. We're getting close to the end, just so that we can have plenty of questions. And I think the way we're going to have to handle questions is maybe the questions in the chat box. So we got to realize that all healthcare, someone is paying for all healthcare. So you might say, well, this healthcare is free. Well, it really is not. I mean, the reality is that someone pays for it. And if you're cutting money, federal money, that ordinarily has been supporting the state, then you either have a choice. You either cut benefits, you cut enrollment, or you cut payments to doctors. So those are the choices. And the kind of cuts they're talking about, $350 billion over the next 10 years, would have a very serious impact in Tennessee. Next slide. There are a couple of things that this plan is decided they're going to keep. They want to keep covering dependents who are under the age of 26 on their parents' plan. So that's a very popular part. Also, the pre-existing conditions. I talked about that earlier, even though they're sort of keeping the protections, partially protection for pre-existing conditions. If a person with pre-existing conditions has a gap in coverage of 63 days or 61 days, I forgot which one, they have to go into a high-risk pool and they'll be charged 30% more, at least up to 30% more. So even though there's some protection for pre-existing conditions, I just hope they can afford it. The reality is that high-risk pools did not work very well before. We're talking about, I showed you those numbers earlier, over 238,000 people who were on the ACA. All of a sudden, if those folks had to go into a high-risk pool, remember about 200,000 are getting help with cost-sharing reductions or advanced premium tax credits, or both. When Tennessee had a high-risk pool, the most ever who got enrolled in the high-risk pool was 5,000 people. So it really, high-risk pools is not the answer. Next slide. Next slide. So as far as, oops, you need to go back one slide.
Oh, okay.
So several taxes are getting they're getting rid of, according to this scenario, would be repealed at the end of this year and get rid of individual mandate. These taxes, we're talking about almost $1 trillion in new taxes. Believe it or not, despite what you have heard on the news, the Affordable Care Act has actually saved the federal budget money. It was completely paid for, and it continues to pay for itself. So, as far as say, well, we've got to get control of the federal budget. Well, actually, we haven't seen a Congressional Budget Office score yet as far as what it would cost. But actually, on a previous bill that was submitted by Ryan, actually that would have cost more money than saved money. So the ACA is not part of the federal deficit problem. It's also going to get rid of the individual employer mandates. The next slide. The next slide, goes into the Congressional Budget Office. Since it has not been scored, meaning it hadn't been evaluated by the Congressional Budget Office, we don't know how many people it would cover or not cover. We don't know how much it will cost or save. So those kinds of things we don't know. However, that doesn't mean we don't do anything. Next slide. It is really important that your congressman hears from you. Emily Fulmer mentioned this earlier in the call. I would encourage you to participate in those meetings. If you all can't get in to see him, collect outside and do some media events. So we're going to have to really help them understand, like Emily said, it's complicated. It's taken many of us years to learn how this goes. Next slide, please. Here is one thing that you can do. You can actually put in this particular phone number. You can write that down. If you've got a pen and piece of paper, write that down. You put this phone number in your text, and then under the in the content area, you put in your zip code, and then it will connect you with your your congressman, and then you can sort of tell them, and you can do that tonight, that this plan doesn't work for us. So call, leave a message, and call again tomorrow. Next slide. Keep that number, and once again, let me remind folks that if you would like to get a copy of this, put your name and your email address in the chat box. We will capture that information to make sure that you get these copies. Now, also, I mentioned earlier that Alexander and Corker are very, very important in regards to this. There's 52 Republican U.S. senators. They need 50 to pass a bill. They need 50 to pass this reform. Alexander and Corker have used the word, rather than replace, we need to repair, so repeal and repair. And personal letters mean a lot. Next slide. Let's go to the next slide. We have been told by a number of different sources that the best place to actually mail a personal letter is actually to their local office. So both Alexander and Senator Corker have offices there in Memphis. So it's really important just to send a personal letter to those two folks to their Memphis office. You know, tell them that you are opposed to the replace. We never said the Affordable Care Act was perfect. Anything this size need to be repaired or tweaked, but it doesn't need to be defunded and doesn't need to be replaced with what they're talking about replacing it with. Before this can become law, it has to be passed by the House. Then also the same law has to be passed by the Senate. And if they're not, they go to a conference committee. And this is where Alexander and Corker are going to be so important in the Senate. We've got to stop this in the U.S. Senate. Next slide. Just a couple other things that you all are currently doing, and thank you very much for the Indivisible group that you all have there in Memphis. You know, share things on your Facebook. That's where a lot of folks hear about these, like events tonight, like in meetings with your congressman. So really do everything you can to post things on the Facebook and your thoughts and what you are doing. Next slide. So I mentioned earlier that we are partners with the Tennessee Justice Center. The Justice Center is going to be conducting weekly calls. If at all possible, we encourage you all to participate in those calls. We think weekly is going to be very important because this is moving very quickly. Like I said earlier, I think the House is hoping to get this passed in the House before the end of March and to send it to the Senate. So there's going to be a fast-moving weekly update at least. Read about this every chance you get in your newspaper. Listen to it on your radio station or TV, and respond. And there's so much happening. It's perfectly okay to contact your congressman or Alexander or Corker daily to tell them that you don't like this part of the plan or you don't like this. So stay at it and continue to let them know. Let's go to the next slide. We're now at the point where we can get to questions. We'll go to the next slide. Once again, stay tuned for some future things that are coming up. And also, we've got to really make sure the public knows that this is going to have serious impact on lots of people in Tennessee. In the last slide, we'll go to the last slide. And let's move, after the last slide, let's move back up to Alexander and Corker's phone number. This is, now we have a few other staff at the healthcare campaign that are navigators to help people enroll, but Walter Davis, our director, Susan Beals, our assistant director, and Kathy Baggett is our volunteer coordinator. So Susan, if you just move back up into that page where we show Alexander and Corker's email address or their contact. Now, please, if you have a question, now's the time to put it in the chat box. And Susan, maybe if you can read some questions that people may have had, and then we can sort of try to answer those questions.
Okay.
We're not going to be able to open up the lines, I think. Susan?
We do have a question. How does a person register for upcoming calls? So that would be on the, we'll send that information out to everybody when we send these slides out. We'll do that. Then there's another question. Can we get a slide with figures on the 8th district with info like that slide you had for the 9th district? So there was that slide.
Yes. Yeah, yes, we can. We'll get that info for the. It may be a little bit more difficult. I know that the Shelby County, the way that part of Shelby County was both the 8th and the 9th district. Sometimes it's hard to come by those numbers, but those numbers are available, and we'll do our best to get them. Yes.
Okay, there's a question that someone, Sarah is a member of Together We Will Tennessee, and a small group is approaching Corker and Alexander later this month on this very thing. Can I please have the slides? My name is Sarah, and then she gives her email.
Yeah, and I've asked Susan to sort of help us make sure that people get a copy of these slides. And Susan, is this something you can do tomorrow,
Yes.
the next day?
Yes, I'm capturing the emails, and we'll have the information sent out to you.
Great, thank you, Susan.
Okay, then is there a good general review about details of the ACA marketplace workings and how TennCare works now?
Let me just answer this question. Think about it this way. There are 22 million people that now have insurance that did not have it before the ACA started. So 22 million people, more people, it shows you that something must be working. And since I helped enroll some of those folks, most of the folks that I enrolled were between poverty and 2.5 times poverty. So, and they got premium tax credits, and they got cost sharing reductions, and they got a lot of help. I know that there are people that were so grateful that they got coverage. There are stories where people that simply, if it had not been for the ACA, they would have died. They would not have gotten the cancer treatment that they are currently getting. I enrolled a gentleman who's in his late 50s, living with his sister, had diagnosed with prostate cancer, and he was getting his care under the ACA. Before the ACA, he would have been excluded because of pre-existing conditions, and I know that probably everyone who helped with enrollment saw those kinds of scenarios. Things is now we know that diabetes and asthma can be controlled with proper medical care. Many times before the ACA, those folks were being excluded. So we know it's not perfect, but we also know that it helped a lot of folks. And so we just cannot sit back and sort of say, okay, we realize it's not perfect, but at the same time, let's be honest about this. It's helped a lot more people than it's hurt. And in fact, it's
Tony, this is Emily. Can you hear me?
Yeah, go for
I
it.
just wanted to, I know we're running out of close on time, but I wanted to say something that was too long to go in the chat box, basically. When we met with Representative Kustoff, he tried it. He said he was trying to link the ACA to rural hospital closings and insurance companies pulling out of the marketplace. I mean, he tried to say that was the fault of the ACA. He also I don't know if it's true, but was saying, oh, all my rural constituents. I have all these rural constituents who are saying the ACA is bad, it's too expensive, they can't get coverage, and they're telling me they want it repealed and replaced. So our strategy is going to try to be to gather positive success stories of the ACA from rural communities. So I'm wondering if you can connect us with any stories TJC has collected from District 8. But the second part of my question is, how do you respond to Custoff saying, oh, the ACA crashed and burned rural hospitals, the emergency center in Jackson, and that's the reason why all these companies are pulling out, like in Knoxville, for example? How do you respond to that?
Well, I would respond to it a couple of different ways, Emily. One is that in Tennessee, 238,000 people have coverage that did not have coverage before. Granted, maybe they didn't have choices. They don't have as many choices as they had when the ACA started. But before the ACA, they had no choice. They got no premium tax credits. They got no cost sharing reductions. So they got no help. So in some places, maybe they only have the choice of one insurer, but in that insurer many times has 4 or 5 different plans they can choose from. So it's not perfect, but it's a lot better than it was before, because before they could not afford it. That's one way I would respond to it. The other way I'd respond to it, and we could sort of send you information about this, is many of the states, Republican states, Kasich in Ohio, they've done some wonderful studies up there to show the real positive impact on hospitals, as well as like the opioid epidemic in Ohio, how that has helped, has provided funding for people that did not have coverage before. In Kentucky, there's some really good information and data about how it's helped rural hospitals. And so we actually have, when 31 states decided to expand and 19 states decided not to expand, we now have empirical data to show that insurance does matter, that it does create jobs, it does save rural hospitals, and if we did not, since we did not expand, it actually puts more pressure on our rural hospitals, and it forces, it hurts their bottom line as opposed to helping it. So there's some really good data from other states that now tell us that Tennessee made a big mistake by not expanding.
This is Susan. I would also add that when the Affordable Care Act came into being, hospitals gave up their disproportionate share payments, called DSH, DSH. So they were getting, that was like for uncompensated care. So now our hospitals don't get the DSH payments. We don't get the expanded Medicaid payments. So that puts puts them into more financial binds as well.
Thank you, Emily. We'll work to get to more information about what's happening in other states and how you can use that to also apply that to Tennessee.
Thanks. That's great.
Okay, so then one person, her husband just had open heart surgery in February thanks to our coverage through the ACA. It is truly a miracle for us.
There you go.
And then there's a question, how are SHIP and QMB affected?
As far as SHIP and QMB, as far as we know, it is not going to, at least these two bills, does not impact Medicare in regards to the Medicare Part D, as well as the closing the donut hole as far as prescription drugs for Medicare. So the taxes that fund those things, those are not being repealed in these bills, at least now. The thing that we have to realize is that there likely will be amendments to these bills, and so this is why we have to watch this on a daily basis. But right now, it does not look like there will be impacted. I will go back to QMB, though. QMB, which is funded by the TennCare program, the states are going to have more flexibility on deciding which programs they're going to fund, which eligibility groups will be funded. And so QMB might be at risk, but as far as the Part D, D as in dog, and the prescription drugs and Medicare, I think that's okay.
Then there's a question, what are SHIP and QMB?
Thank you. QMB is Qualified Medicare Beneficiaries. That is a program for people who are below poverty. A family of one is about 12,000 a year. A family of two is about 16,000 a year. If they're below that, that's below poverty. Uh, and if they have to be on Medicare. And if you're on Medicare, you also realize that you have to also uh, pay for Medicare Part D, also have to pay for Medicare Part D as in dog, Medicare Part B as in boy, and also there's other costs involved. If you're below poverty and you're on Medicare, right now the ACA requires that the state and the federal government pick up the balance. And so a QMB plan for a low-income senior who's on Medicare is like having a supplemental Medicare policy. In fact, it's better than a supplemental Medicare policy. So all your medical care would be covered either by Medicare or TennCare. Now, the SHIP is State Health Insurance Program. That is a program that's being funded by the federal government primarily to enroll people into QMB and into Medicare Part D as in dog, help people. Well, that was very timely. Uh, so that's what the SHIP program does. It's a federal program that's administered by the states to help people get the Medicare benefits that they're due.
Okay, good. It looks like Sarah and Emily, wait a minute. So, two of you are going to work together and put a presentation for Custoff, Emily and Allison Lasser. And okay, then there's a question. Can you talk more about the letter we want to get Corker and Alexander to sign?
It's not so much getting them to sign a letter as it is the importance of having personal handwritten letters to Corker and Alexander. We have been told by a number of sources that personal handwritten letters are the most important. Uh, Phone calls are better than emails. So sending an email is probably on the bottom of the totem pole. The next higher up, as far as uh, having an impact, would be phone calls. And above that are personal handwritten letters. And this is where we encourage people to actually send those handwritten letters to their local office there in Memphis. For this reason, if you send it to Washington, D.C., it goes through an anthrax test and other tests in regards to, whether the letters are being poisoned or whatever there might be in a letter or a package or whatever. So the fact of the matter is, if you send it to their local office, that's a handwritten letter to their local office. From what we've been told by congressional aides and others, is the most effective way to get your point across. We would encourage you when you write your letter I bet everybody has a story about a medical condition, pre-existing condition of a member in your family or a relative that you know who's had a hard time getting health insurance or before the ACA, or the ACA has helped them get the care they need. So put that personal story in there. Those are the most impactful.
Okay, so the question was not really that. It was more in reference to the letter that the four Republican uh, representatives signed.
Okay.
That they didn't want the replacement if it didn't do the block
Well,
expansion after
good.
20.
Okay. Thank you. Thank you very much. I appreciate that. Actually, I was looking at that letter today, and what we can do is we can um, attach that to anybody who puts in their email address and their name. We'll also send them a copy of this letter. It will list the names of the four U.S. senators who have said that under the current bill that's being proposed by the House, they cannot support that. So the Senate is going to weigh in, but we have got to help our two senators, Alexander and Corker, develop a very strong backbone on behalf of the people in Tennessee. I think someone just put something in the chat box about their personal story about pre-existing condition and being pregnant. I mean, those are the powerful stories that I think that really impact. And sometimes you don't know how impactful your story will be. You don't know that a particular U.S. senator or congressperson actually had a similar experience in their life, and so when you mention it, it really speaks to them directly. So this is another reason why tell your story. Right now, you may not know how powerful it will be, but later on, you'll find out it was probably very powerful. I think we need to probably close this up. I wonder if Emily's on the phone, and maybe Emily wants to maybe do some closing remarks, if Emily's available.
Sarah, if you'll give me a call tomorrow, we can talk about the stuff that you're putting in the chat box. And I've just sent you my phone number, my office phone number.
615-227-7500 extension 8.
Asking to be the presenter, so let me do that.
Tony, can you hear me?
We can, yes.
Oh, hi, this is Mark Brooks in Nashville.
Good.
Oh, hi, Mark.
I just wanted to mention something real quickly. Mitch McConnell did something very strange, I thought, today. I don't know if, correct me if other people have a different opinion, but he said that he plans to take the House bill if it passes straight to the Senate floor, bypassing the committees, which strikes me as a strategy that should be guaranteed to really anger people like Alexander in particular and Corker. So I'm wondering if maybe it's a strategy where he just wants to get this thing to fail quickly, but I'm not going to count on that. But the reason I bring it up is those other 4 senators, their concern, I think it was Murkowski from Alaska, and I forget the other 3, but their concern was that this bill would basically phase out the Medicaid expansions, and all of their states expanded Medicaid. That's probably not a very effective argument for Corker and Alexander because, of course, Tennessee refused to expand Medicaid. However, Alexander in particular has been very clear that he thinks that this repeal and so-called replace or repair needs to go through a very thoughtful process, and that the repair or whatever has to happen simultaneously. And so if McConnell tries to push through what he's trying to do, it strikes me as an opportunity for us to peel off Alexander and Corker. That is, for us to keep insisting that this needs to be a thoughtful process, that it's absolutely irresponsible to just ram this through quickly, and it's going to hurt a lot of people if it's not done otherwise. And for McConnell to say he's going to bypass the committee structure strikes me as maybe playing into our hands. That's all.
Thank you, Mark. Mark is one of the leaders for the Indivisible group here in Nashville. Thank you very much. That's actually a very thoughtful remark. I'm going to go and close this up unless Emily would like to make any closing remarks.
Yeah, I'm here. If you could, can you hear me?
Yes.
Okay. I just really appreciate this. I mean, the more that you said, the more I realized I didn't know, and I just really want to dig into it. So I look forward to the info that you'll send out. And I just want to encourage anybody that's on that has not connected with the Indivisible Memphis group, who might want to be present in our next meeting with Representative Kustoff. If you're definitely in his district, you can email me at indivisiblememphis@gmail.com, because we had such a great team last time, and we really want to bring in more and different people who can share their stories. So if you want to be a part of that meeting, indivisiblememphis@gmail.com. And that's all. I just really appreciate this presentation, Tony. Thanks.
Thank you. Good evening. Bye-bye. Thank you, Susan.
Okay, bye-bye.